Good evening, everyone, and welcome to a very special edition of Spanning the Need. Tonight, we're going to talk about vaccines, myths, truths, misinformation. And here to do that with us from Mercy Health, Dr. James Kravec. How are you doing, doctor?
How are you? I hope you're having a good day.
So we'll be talking a lot about kind of the myths and misinformation that's really been talked about with this vaccine on social media and some other areas on the web. And I wanted to make sure that in talking with the doc before this, we wanted to make sure that we can get you the correct information that you're well prepared on and your decisions for your family and everything. So, Doc, before we get started, talk a little bit about your background and kind of how you got to where you are now.
So I was born in Youngstown, born at St. Elizabeth, went all through school in the Mahoning Valley, St. Christine's, Cardinal Mooney, Youngstown State, and then went to Neomed, which is about 30 minutes west of Mahoning County in Rootstown. Did training in Akron at Summa Health for internal medicine, and then came back to St. Elizabeth Mercy Health in 2005, really just as an internal medicine doctor, as a residency faculty member for the internal medicine residency for the St. Elizabeth Internal Medicine Residency Program. My wife is an internist as well. She's from Cleveland. We met in medical school, so we both came back to do the same job, really, taking care of patients at the internal medicine residency clinic on the campus of St. E's on the north side. And then I started doing some hospice and palliative care work and became board certified in addition to internal medicine, also in hospice and palliative care. And I worked at Hospice of the Valley, which is part of Mercy Health as well. I did that for about 7 years. And in 2013, started doing part-time and then more part-time administrative work through Mercy Health as president of our physician group called Mercy Health Physicians. And then in 2016, it turned into a role called the Chief Clinical Officer. I was the first person in that role in 2016, still in that role now. And really that role is overseeing the 3 hospitals we have as far as the physicians and clinical quality, recruiting, education for the medical students and other learners. And really that covers St. Elizabeth Youngstown, St. Joseph Warren, St. Elizabeth Boardman, as well as our Mercy Health Physician Group, which is really 350 employed doctors, nurse practitioners, physician assistants, and then 170 resident and fellows. Those are physicians in training. So that's really what I do as far as my day-to-day. I also am the medical director of Mahoning County Public Health Department. I've done that since 2016 or 17, working with the health commissioner and the director of nursing and the director of epidemiology and the team at Mahoning County.
I can only imagine that you weren't signing up for this type of work.
Yeah, especially right. I remember January of 2020, we had a pandemic flu drill. So it was with the county emergency management, the health system with Mercy, the Board of Health, and we said, what if there was like a terrible flu and we had to vaccinate everybody? And what if there was a terrible flu and a lot of people got admitted? That was in January of 2020. We had that drill, that planning exercise. And several months later, it was real with COVID as far as the many sick patients. And then now a year later, it's real as far as the mass vaccinations. So, right, I didn't plan for this. Public health was mainly a very advisory role in the sense of what might be best for the public health of the community, working on social determinants of health. But really, this has turned into a quite the experience over the last 13, 14 months now.
Well, and I had probably a while back ago, I had Aaron Bishop, commissioner of the city of Youngstown's health department, and the mayor. We talked about, and she was mentioning, like, I didn't sign up for this. I wasn't even supposed to go into the business, and I thought, oh, this was fun, and I became the health commissioner. And I think no one, you just think that you're looking at, hey, the health of the community, great. You're not thinking of a 100-year pandemic, almost like you hate to say 100-year flood.
Right. Well, no, and so I went to grade school with Aaron. I've been friends with Aaron forever, and we remain close friends. And so I've had a chance to talk with her before, during, and then after all these issues. And so I know how hard she works, and how lucky the city is to have her as the health commissioner. But really working with Ryan Tekak daily with the county. Ryan jumped into this role. He took over for Pat Sweeney, who was in the role for a long time. Pat retired. Ryan
20, 30 years.
Pat was in there a long time. I think Ryan took over February 1st of 2020. And so he jumped into us a couple weeks later with COVID. But Ryan's done a wonderful job with Erica Horner, Susan Kovac with the county as well, Dennis O'Hara with Mahoning County EMA. And so I get a chance to work with all these great people daily. But we also have great people in Columbiana County. Wes Vins, the Columbiana County Health Commissioner, just very, very thorough. Frank Migliosi and John May with Warren. It was Trumbull County and Warren City Health Department. Just great people in public health. And I think what this has outlined is really the fact that public health is so important. It's so important. And the fact that Mercy Health and the public health departments, really all of them in our communities, have such a great close relationship, and we talk all the time. I think that's really, really important to know that the connectivity between these groups is essential to the health and well-being of our community every day, but especially when there's something like this going on with the pandemic. We talk, we text, we email 7 days a week about planning and how we can help each other, and how we can, there's a patient that needs seen by Mercy that was seen at the health department or the other way around, and those conversations happen all the time.
Well, it's funny because it's like you guys probably got this long text message chain with 8 of you in it, and it just keeps on going probably, and you could probably look back on past text messages from a year ago.
Oh, it's crazy. We've learned so much together from testing. I remember getting calls about testing a year ago saying, hey, who has availability for testing? And now it's who can get someone in for a vaccine, which is so encouraging. I remember on Halloween, so October 31st of 2020, I was out with my kids walking the neighborhood. It was one of those, should we be doing this? But I felt it was safe with mask wearing. We were distanced outside. And one of my neighbors came over, who I know fairly well. He said, I'm getting frustrated with all of this. It's been 5 months. He goes, what's the end game? I don't know the end game to this. There may be a little slant to his question, like, what are you doing here? And my answer, the end game is the vaccine. That's the end game. We need to stay well till the vaccine. And so, in the beginning, it was flatten the curve, right? And we did that. We flattened the curve, because if we didn't, we would have had an overrun healthcare system. People would have died because there were no ventilators. Would have happened. We had projections for that. We had projections in early April of quadruple the number of patients, or quintuple the number of patients we had in the hospital. You know about the Covelli Center plans last year. That was because we were going to be overrun, and we were going to do the best we can to handle what we had.
Well, and it's funny that you say that, because people, like back then, I would say probably in the midst of everything, I had Mr. Ralph from Science, from the Children's Museum of the Mahoning Valley, and we worked with YSU, and we did a mask test on different masks by N95s, cloth masks, and it showed the difference of basically, hey, the N95s are the best. These do 98%, 99%, and then you went down as you just had the bandanas that you could see through. So by just doing that, seeing it in front of your face shows that masks work. Now, are they 100%? We know that that's not true. But at the same time, it does show protective for you and the person that's hopefully 6 feet from you or farther. Is that about a correct statement?
Absolutely. The number one factor of safety during this past year has been masks. It's evidenced by multiple things. Okay. So first of all, masks, social distancing, not touching, all that stuff, staying home when you're sick, all very important. If you pinned me down and said, what is the number one thing? It's mask wearing. Okay. And did we know that? We didn't know that. Dr. Fauci gets criticized periodically for not saying that. We didn't know what we didn't know back then. But the more science we had, that is the number one factor that I continue to stress as we go forward here.
Well, now we are, I'd say, a little over a year into this pandemic. I think they said March 11th or March 12th was the first, give or take a day.
March 11th at 1:57 was the first positive patient in the Mahoning Valley.
Yikes, that's scary. So let's talk. Now you have 3 emergency vaccine uses approved by the CDC and I think the FDA. Is that a true statement, or just the CDC?
It's through I think their emergency use authorizations through the FDA, I believe is how it's set up.
Okay, so we have Moderna's, we have Johnson and Johnson, and the third one is
Pfizer.
Pfizer. Can you talk a little bit about each? Because each is different in its own way. You have two of the shots that come with a boost with it. So they have both two shots, and then you have Johnson and Johnson with just one. Can you talk about just real quick about the different three?
So Moderna and Pfizer both require a second dose. These are both messenger RNA viruses. So that means they take information about the virus and put it in a small type of messenger RNA. That then is injected into us. It doesn't change our genetic makeup. It doesn't change our DNA. It makes our body think we are reacting to that virus. That's both for Moderna and for Pfizer. Moderna needs a second booster, 28 days. Pfizer needs a second booster, 21 days. After 2 weeks after your second dose, you're around 94 to 95% protected from all types of COVID-19 infection.
Now, does that include the variants that's been going around?
We think it does.
Okay.
Over time, that will drop, and I'll talk about that in a minute as far as variants. That's a really important point. Pfizer is a little more challenging because it requires different storage. In the beginning, it was ultra cold freezers at minus 90 degrees.
Right.
Celsius freezers. Now it's a little bit better, a little warmer, but still it's more challenging. Moderna is still challenging in the sense of, when you crack open the bottle and put the needle in for the first time, you have to use them all within a certain number of hours, and it's short. Whereas the flu vaccine and other vaccines are longer. So that's those two. They're both about 94 to 95% effective. It's 2 shots, 21 or 28 days apart. Pfizer is 16 and older. Moderna is 18 and older. That's what we had. I got Moderna. My wife had Moderna. My mom had Pfizer. Right? That's just what's out there. J&J, Johnson and Johnson, you might call it Janssen. There's different terminologies. That's a 1 dose. It is more of an adenovirus vector. So it's a different type of virus that's changed and inserts that type of a chemical or a part of the virus in there, the dead part of the virus. It's not live virus. That's 1 shot. It's around 62 to 65% effective for all comers of COVID. But in the mid 80s, I think it's 84 to 80, 85% of serious cases of COVID, hospitalizations of COVID, and they are 100% in death. Okay, so let's talk about this. So good. And it's 1 shot. Storage is a little bit easier. So you would say, well, I don't want a 62%. I want a 95%. The key point is really not that you might have a cold. It's that you're going to have the serious illness or death, which is, so they're in the 80s to 90s. Put it in comparison, the flu shot is around 50% every year.
Really? I never knew that.
It's about 50% effective in good years. In some years, it's less effective. So that's put that in comparison. The other thing is, even if it's not effective, it might reduce, just like the flu shot. By getting COVID, you might have a lesser impact on your body because there's some level of immunity. So that's another piece of the vaccine if you're in that small percentage. And I think as we think about the percentages, the trials for the emergency use authorization for Moderna and Pfizer were done in October, November. J&J was done in January, February. Variants started happening. So one could argue the lower percentage of J&J maybe because there might have been more mutations by then. So it's hard to do an apples to apples study comparison on these viruses and on these vaccines and the percentages. Let's talk about mutations for a minute. This is important, I think. Mutations are not shocking, unheard of, or surprising to me. This is what viruses do. They mutate. So the fact that we have the UK variant, the South African variant, the Brazilian variant, and there's more, doesn't shock me. That's expected. So far, we think the vaccine works against them. At some point, they won't, and probably you'll need a booster. We're not sure. I could be wrong. I've been wrong on a lot of stuff with this. You probably will need a booster at some point, and the booster is going to take into account the variants that are realizing. That's what they do with the flu shot. The flu shot vaccine takes months, 6 months to make for the northern hemisphere that the southern hemisphere saw. They take what flu strains in the southern hemisphere happen and make our northern hemisphere vaccine based on what the southern hemisphere saw. If they're right, they're wrong some years. So I think that will continue to happen with COVID. Or just like other coronaviruses we've had, SARS, MERS, which was in 2012, SARS in 2001, 2002, it kind of went away. That could happen too. We don't know yet. So a lot of unknown about these viruses, but the vaccines themselves, I trust them. I've had them. I recommend them to people. Certainly talk to your doctor if you have concerns, but that is the end game to this year-long pandemic we've had.
And we've actually seen a lot of people have huge side effects to some of these shots. I don't. There's been discrepancies on which shot they got, but some of them were tired, achy arms, had some sickness to them. Is this expected with these side effects for certain shots? Because I think people sometimes get nervous because, and to add on to that, I'll add on another part B of that question, or should statement is there is a lot of people. I think one poll said 56% of the United States that was polled. I don't know if those are by party affiliation that they're hesitant to take a shot at all.
Yeah, so I think this is probably one of the most important things I can say about this. And you use the terminology everyone uses, but let me correct that. They're not side effects. These are expected reactions.
Okay.
Expected immune reactions to a vaccine. So again, side effects would mean, something negative that rarely happens. One of those deals. This is an expected immune reaction. This is what's supposed to happen. We're supposed.
This was what was in their studies that they showed.
Exactly.
Is that
this is
okay?
And I will affirm what you said. People do have this expected immune reaction, and it kind of stinks. I'm 43 years old, so I'm in that age group, and that's important in a minute. I had shakes, chills, aches, a little bit of nausea. It lasted about 35 to 40 hours. Sore arm for a couple days after that. Woke up the next day completely normal. Okay, so I had that. My wife had the same thing. Some people have nothing. It's around 50% of the people. So not 5 or 10 like we see with most medicines or whatnot, or 3 or 2%. It's 50%. As you get older, first of all, we a little bit more with Moderna than Pfizer. Okay, it happens with the second shot mainly. It happens with the first shot if you had COVID before. Either if you didn't know you had it, but you had it, or if you knew you had it. Okay, that's the first shot. I had mine with the second shot. I didn't have COVID that I was aware of. If I think about this, though, my message is, I had a pretty terrible day. I went to work still, was able to do my job. My wife is a doctor as well. She saw her patients, was able to do her job. Felt, headache, achy, didn't feel great. However, we have had a lot of people die with COVID-19. We've had a lot of people have serious illness. We have a lot of people with mild symptoms. COVID isn't just a self-limiting all the time. It's called the COVID long hauler. These people have symptoms for a long time. Fatigue, pain, trouble breathing, anxiety, mental distress for months, sometimes up to a year or longer, that we don't have enough information yet. So my 35 hours or whatnot, I'll take that any day given over getting COVID. So that's one comment. Second comment is as you get older, it's less, people experience it less. I've talked about, and again, this is anecdotal, but a lot of people in their 70s and 80s didn't have that. A lot of people in their 30s and 40s did. So, and that's what the studies are showing too. The younger people have more symptoms. It is the absolute right thing to do to get vaccinated. We need people to get vaccinated to have what's called herd immunity. I'll talk about that in a minute. If you don't care about yourself getting COVID and you say, I'll fight through it, I don't care, I'm not going to die, I have no underlying conditions. Okay, we need you to get vaccinated to protect the population as a whole. That's how we get rid of smallpox, measles, mumps, all those things we rarely hear of. You have to have a certain number of people vaccinated.
Do you recommend? I know this was a big question that we got. There are a lot of pregnant women out there. Do you recommend that they get vaccinated, or do you recommend that they get kind of after their pregnancy?
You know what? Certainly always talk with your OBGYN doctor. Talk with your physician. The studies don't show problems that we can tell. And we also know many OB groups, the national groups for pediatrics and national groups for OBGYN are recommending it.
Okay. It was just a question because I know that was a big thing right now with pregnancies, and my sister just had her baby, so.
Yeah, always talk to your own physician, but the national societies are recommending it.
Okay. Sorry, I had to cut in. Before I lost my question. Then go ahead and talk about, I think you were going to talk about like why people are thinking twice about getting vaccinated and stuff like that.
I think people tell me this. So the pregnancy issue is one. Okay, I understand that. I understand it. I do. But the recommendations from national agents, OBGYN groups and whatnot are saying to recommending it. People are saying, well, it's an emergency use authorization. It is. This isn't brand new technology they came up with over a few months. This adenovirus vector for the Johnson & Johnson, that's been around in many other vaccines. The mRNA has been studied for 20 years, how to do this. So we were able to roll it out quicker because we now had the actual COVID-19 virus and just put it in the technology we already had. This isn't experimental. Will it change when it's done, when it's finally FDA approved? It certainly may. It certainly may change when it's approved. And that's what happens with the emergency use authorizations. It changes, probably not dramatically, but it may a little bit. But everything we can tell from these initial studies, there's no terrible harm. Now, do I have years and years of data? No, we don't yet. What I do know is what we see with these COVID-19 spikes, and people are getting very sick and dying, and the government would shut down places and schools shut down, and there's long-term consequences versus this. For me, it's a risk benefit. But that's why people say there's not enough data sometimes. People say there's not enough long-term studies, and those aren't wrong to say that. The pregnancy, I get that. When people say, I don't care, or I'll get sick, I don't care what happened, that's when I kind of push back on and say, this is for the community. This is for the overall population. This is how public health works. This is how infections work. This is how you get vaccinated to not have illness for everyone else. Even if you don't care. You don't care if you get it. You don't care if you die from it. If you don't care, you're going to spread to other people who for whatever reason, can't. They're concerned about the pregnancy issue. Whatever. You need to stop that. You need to get so many people vaccinated to stop that spread.
Well, and that's a great follow-up to that is we've talked, this has been one of those stipulation questions is, okay, I've gotten vaccinated. Okay. And should I not wear a mask, or can I be asymptomatic and pass it to someone else? Like if I'm walking in the grocery store or something like that. I think those have been some big questions about it. What information do we know or have that can be shared?
Those are great questions. And so as we tape this, and I know this is going to be aired, and as we continue talking, right, and things will change. You're watching this live, it's going to be changed because things, I've said things before throughout the last year, and a day later, things change. So I'm going to tell you what I know now is, and then this is different than it was a couple weeks ago. But when you're vaccinated, we still recommend mask wearing for a couple reasons. One is we don't know, to your point of your question about, is it, can it be spread? We think probably not. That's good. That's really good news. Because if you can still be an asymptomatic spreader when you're vaccinated, that's a problem. We think, there's a study in Israel that came out and said probably not. You probably aren't spreading it, but we're not 100% sure yet. And so like with most things, this will change. So that's one comment of why you still wear a mask at that point. Second reason you do is we need to have a critical mass of people vaccinated until it truly goes away. Let me kind of explain this. If you're 95% with Pfizer and Moderna, that means there's a 5% chance that you still could contract it. But if everyone else is vaccinated, those chances are real low. But if you're 95% safe, means 5% not safe, and there's tons and tons of COVID people out there with positive, your chances are much higher. So that's the reason we do it. And in the third sense, in the practical sense, we don't have a tattoo on our head or on our arm that says I'm vaccinated. So how do we possibly enforce any sort of stipulations of mask wearing, not mask wearing, not knowing who's vaccinated or not? So that's the practical public health answer. So it's still recommended. The follow-up question you might ask is, well, what can people do when they're vaccinated? When can I go be even normal again? I'm vaccinated, and you'll see me at Sparkle and Giant Eagle in the mall still wearing a mask, because when I'm around unknown people or a population, the CDC guidance is to still wear a mask. Now, if I am in a home, and I had this last week, another person came over who was vaccinated. The CDC guidance says people who are vaccinated can come together without masks and social distancing. That's good. That's what we want. But both parties, it was my wife and I and another friend who was vaccinated, came together in our house. That worked out fine because we were vaccinated. So that's kind of the how it changes once you're post-vaccine.
Well, and I think it brings up a good point is, okay, you want to be vaccinated, great. Let's get the human immune or herd immune. But now I'll make this real quick, is now you're seeing a huge surge in Europe for a lot of, I don't know if it's the variants, they're doing a lot more shutdowns now and everything like that. Do we see, I think this just came out just a little bit ago, that says that the airlines are looking that you should have a vaccinated card or something to fly. But I think that's more for them trying to increase their business, probably, because people aren't really traveling.
I think it's a race. It's a race before the mutations cause another spike, and the race is with those getting vaccinated, right? So you got to look at both of those. And so the more vaccinated, the quicker, and the more people get vaccinated, that's less people in the pool that are going to get sick with the vaccine. That's how I look at it.
Yeah,
with the virus, I mean, yeah.
A study just came out from I think it's Journal of Clinical Infection, that says that, I think that's clinical, that just came out, that talked about a school in Miami-Dade County, about if students were 3 feet apart and wearing masks. I haven't read the report yet, but I just heard it briefly. Do we still think 6 feet is good with masks?
Yeah. So again, as I said in the beginning, if I had to pick one, if you pinned me down and said the one thing of all of the public health measures, it's mask wearing. Okay. Now, why that's important, I think, is this. I have 4 kids in school. The rooms are not big enough to be 6 feet apart. They're 3 to 4 to 5 feet apart. Okay.
Older buildings.
They're older buildings. You can't build new schools in 3 months, or nor is there money to do that. We understand that. So, I think in the end, the study that came out in Miami, I saw that too. There'll be more. Probably is more reasonable. It's probably more practical. It's probably more practical. Of course, if we're both infected and I'm further apart from you, there's less chance you're going to get it if you're 6 feet than 3 feet. Wearing a mask, both of us, it's much lower. So I think in the end, this is my personal opinion, not the CDC yet, or not Ohio Department of Health. The space is going to be reduced again to 3 or whatnot. Schools, the Ohio Department of Health and Governor DeWine in December came out with a statement that said, kids that are in school that are 3 feet apart, as long as they're all masked, you're not popped out of school in a quarantine. And so that was my first indication that they're looking at the 3 feet rule instead of the 6 feet rule, because they're not spreading it. If I'm sick and you're 3 feet apart, you're not getting it if we're both wearing masks. That's good. And so I think they're going to do that. Even from a practical sense of church or public events, churches are only so big, and you can't double the amount of services you have because there's not enough priests or ministers to do that. So when people start coming back, we have to make the decision, well, do you kick them out? Do you have more services? Both probably aren't very reasonable. Or do you say, well, we're going to have to go to 3 feet again. Just don't touch each other. Just don't hug each other, and everyone wear masks. That's probably where it needs to be. Probably. We'll see.
Well, and we've covered quite a bit in a short period of time. Is there anything that we haven't covered that you may want to share with our viewers?
I think the Governor DeWine has talked about when all the health orders will be removed. He said when the positive case count is 50 per 100,000. We were at 450, 180, 150. It's dropping. That's really good. And so I think we're not over the finish line yet. We're using some sports analogies. We're almost at the finish line. The other analogy someone asked me is, what inning of baseball are we in? I said probably in the 8th. Hopefully no extra innings. Hopefully we're in the 8th. And how do we get to the 9th and finish the game? We get vaccinated, absolute number one. And we continue with our public health measures, continue mask wearing, social distancing, to get that number down. The key is to not have more gatherings to then spike up the numbers, because if the numbers go back up, public health measures will stay in place, more people will get sick, and we're not able, the game is not quite consistent. So those are my two recommendations of how we get there, is we get vaccinated and we continue the pressure, keep the pressure on. I know it's not fun. I know we want to go back to normal, right? The good news is we're getting up to springtime, and baseball and track and things outside, that's fun. Outdoor picnics, that's better than indoors, And so as I look at March of 2020 versus March of 2021, we were getting to the spring then, but it was getting worse. And now we're getting better. We can't finish this race before we cross the finish line. Can't finish the baseball game before we get to the 9th inning. Those are the two sports analogies, and it's really true. We can't do that now. We're not there yet. We're not vaccinated enough. We have 25-30% of the population in the Mahoning Valley vaccinated. It's good. We need to get to 70 or 80%. So
yeah, and I think that's all good information, and we did great with doing it, and I appreciate your time out of your busy schedule. I know you're working hard. We thank you and your Mercy Health staff for everything they've done during this pandemic. I can only imagine what they were going through and the stories I hear. I have some friends that work there as well. I've just heard some stories, and just from all facilities in general. So I thank you for your time.
Well, no, I think our staff's amazing. We have, from our physicians to our nurses, respiratory therapists, other staff, our staff giving the vaccines, the staff working the flu clinics, the ERs, the intensive care units, COVID units. Really, I mean, think about what they've had to go through. The staff in the operating room, changing the protocol they've had. All of that has been nothing but amazing, and people on doing video visits instead of in-person visits, and how do we transition back, doing Zoom interviews instead of in person, like as we're talking now. And all our staff is just amazing that they've done, and they're getting tired, of course. They've been through
I can't blame them.
They're getting tired, and so I'm just so appreciative to what they do, and we're getting there, but we're not done yet.
Doctor, thank you for taking time out of your busy schedule.
Thank you so much for having me as a guest today.
You're welcome. Thank you, everyone, for joining us. Hopefully you are educated as much as I am on what's going on, and some updates, and getting rid of the myths and misinformation, and getting the facts directly from the doctor. So I appreciate everyone. If you would like to see more podcasts or interviews, please go to anthonyvspano.com. Stay safe. God bless everyone.